Hi, everybody. I'm Angela Hart. Welcome to the Heart of New York show. This show is about autism, and it's about research that's being done so that children who have autism will not lose speech at a young age. It is not inevitable, says Dr. Knut Witkowski, who's sitting with me here, and I'm going to let him introduce himself to you. He's a scientist with Rockefeller University. Please, Dr. Witkowski, share with the viewers about your background and what your hypothesis is, because a lot of people have families who are impacted by autism.
My background is in statistics and genetics, and by coincidence, we started working on autism, on the genetics on autism, and I compared nonverbal to verbal autism. There's something striking. Of the 20,000 children in the US who become nonverbal every year, half of them start talking. Mama, Papa, Dada, a couple of words. And then they stop and will never say a single word for the rest of their life. I said, why are they stopping to talk? No child just stops seeing, stops smelling, stops hearing. Why do they stop talking? And when we looked into the genetics, we found the same risk factors that we know are causing migraines. Now, children who develop autism are known to have childhood forms of migraines. It's not necessarily headache, could be abdominal migraines, could be vomiting, could be colics, different manifestations, but as unpleasant as headache migraines are. And what triggers these migraines is that the neurons cannot deal with stress. And children, when they start talking, during the stranger fear period, they have a lot of stress. They have to learn how to walk, they have to learn how to talk, and they have to learn how to distinguish between family, friends, and foes.
Don't look at me when you say foe.
And so, if the neurons cannot handle that stress, then every time they interact with a stranger, every time they speak, they get a migraine. And one day, when they make that connection, they do what everybody does who has a migraine. They withdraw from social contact, they don't talk, they ignore people. So the reason for stopping to talk is that they get migraines.
This is your hypothesis? Or
That is the hypothesis. I may be wrong, but I challenge everybody to come up with a better hypothesis. I have never heard one. Now, because we know what's wrong with the neurons, we know what type of treatment to give them to prevent these migraines. It is a medication that is very similar to Motrin, aspirin, ibuprofen, and NSAID. It's a different one that's actually approved in the United States for the treatment of dysmenorrhea, including the prevention of menstrual migraines. So we know the children stop talking because every time they talk, they get a migraine. When I say no, that's hypothesis. But this is how the thoughts go. And to prevent the migraines, they stop talking. If we can give them the medication to prevent the migraines, they can continue to talk.
this is an
Very
excellent,
easy.
This is an excellent hypothesis. Now, how can we, what is the next step in science after a hypothesis? What is the next step?
Okay, the first step was to publish that. So we published that in 2014 in one of the highest ranking journals in the field, the Nature Journal Translational Psychiatry. And I thought that people would be excited. Nobody was excited. Nobody would even consider that because this thinking is there's nothing you can do.
Oh, that's terrible. That's terrible. They won't even be open to the idea of it, and
No. I tried since early 2014 to start interesting people, scientists, family organizations, parents, anybody, and nobody is interested.
I'm interested, and the viewers, especially those impacted by family members with autism, will be very interested, Dr. Witkowski.
I think the reason is that you have to act in the early second year of life. After that, you can't bring language back with very few exceptions. And we know that, for instance, from cochlear implants. When children get a cochlear implant, and typically during the first year of life, they develop language. However, if they get a cochlear implant after the age of 2, most of these children do not really develop language and become intellectually disabled.
That's fascinating. I didn't know that. So that's amazing. So that's kind of a basis for some of your theory, yes?
Yeah, the basis is the second year of life is important for learning language. The second year of life is the window of opportunity for learning active language. So we have to do something during that period. If we know that it's migraines, we cannot yet use the typical migraine medication that you give people the very moment they get the migraine.
Why?
Because the children cannot tell you. These are 1-year-old children. They don't know what a migraine is. They can't express anything. They just have mama, papa, dada, a few words.
So how can we find out that they're having a migraine?
We can test the children. So at the 9-month well-child visit, the CDC recommends, and Medicare actually requests it, or Medicaid, the children's parents fill out a questionnaire for developmental delay. And if there are red flags in that questionnaire, you can follow up. We know the neurons are hyperexcitable, and we know how that looks like in EEG. You have what's called epileptiform discharges in EEG. It's the sign that the neurons cannot handle stress well. And the next step is eye tracking. If the children do not look into somebody's eyes, but have a tendency, if they're sitting in front of a TV with somebody talking to them, to avoid eye contact, then we see prodromal signs that they have a problem and have the tendency already to withdraw from social contacts. And if we see all that, that would be the time to start giving them a medication to prevent the migraines.
So if I'm a viewer who has a child with these signs, my first thought is going to be, I'm concerned about giving them a drug that might fix something that they might have if they have not been already diagnosed, right? You must hear this a lot.
Yes.
So what's the
That's
answer?
one of the concerns. Now, the good thing is that this drug that activates outward potassium channels, which is the mechanism that's disturbed there, this drug has been given for over 50 years to children starting at 6 months of age for the treatment of chronic pain in juvenile arthritis.
Oh,
So over 50 years, children, and for many years, have been given that drug and tolerated reasonably well.
very few side effects, if any. Are there any?
The only known side effect is diarrhea. Many NSAIDs have that, and this class of NSAIDs has it even more. So one needs to do something about the diarrhea, and one can do something. One can prevent that drug. It's like it's an acid drug, One can make it non-acidic in the intestine, make sure that it only becomes acidic when it gets into the bloodstream, and so reduce the risk of diarrhea. But other than that, there were no severe events that were noted. Over 50 years, there were 6 reports of adverse events, and they were all over the place. There was no signal indicating that they have anything to do with each other. So many of those are likely just reports where things were reported where the cause was reported as the effect, or the other way around. So we have a drug that is as safe as it gets. And we have to, if children develop language, you give it for 3 months. After 3 months, they already have maybe 10 words. And then you can stop treating them and just observe whether they continue to acquire more words or whether they, say, show signs of regression, and then you start again.
Wait, why would you just do it for 3 months? I'm just curious.
For the reason that you mentioned, we don't want to overtreat.
Okay.
So if a child doesn't need it, we want to limit the period where the child gets it as much as we can.
How can you start some studies in this area? What is the next step?
The next step, because the drug has been given to children for over 50 years, and the modification to make it safer is not creating a new drug. We have what the FDA calls a new clinical indication for an existing and approved drug. And with that, we can go straight to a study in children, because we have to do it in children. Because that situation, that stranger anxiety triggers childhood migraines, it never happens at another time in the life of children, so we have to do it in this population of children.
I hear you focusing on the stranger anxiety aspect as to what caused the migraine. Are there other ideas that you have caused the migraine? Could it be gestational? Is that the right terminology? Did I hear
Now,
that?
what you hear about are childhood manifestations of migraines. So they do not have, mentioned that before, the typical headache migraines that adults have. Children have migraines, abdominal migraines. So that is something that you can observe in children, but it's not so specific that you would now, oh, now the child has a migraine, now I can give a triptan, a migraine, acute migraine medication. We have to treat, prevent.
I'm sorry, and I'm sure that some of the other viewers may have not followed it either, only because we're not in the medical or scientific field. So what you're saying is children get migraines in their intestines versus the head? Did
Yep.
I hear that correctly?
Yep.
And so how do we know that this is what's happening besides the diarrhea? Is there a blood test?
Now, we know that these children have abdominal migraines. We
How
also
do we know this?
This is a known phenotype in children developing autism.
Okay, wonderful. So we're already there. We already know that they have these.
We know they have migraines.
Wow. And your idea is to treat the migraines so they don't become nonverbal. Did I get that right?
Yep.
It sounds very simple. Because when we're talking about migraines, although it's in their intestines, there must be something going on into the head as well, right?
It doesn't have to be in the head. It just has to be so unpleasant that they rather avoid interacting with people to prevent these migraines.
Okay, so it's the psychological effect that the discomfort causes.
Yes.
That your theory is that causes them to lose speech. That's interesting. Have any other studies been done about the psychological aspects or emotional aspects of a child who then becomes nonverbal as it relates to autism?
I'm not aware of such studies. And it's very difficult to distinguish cause from effect here. But what we know is that the concept of excitation-inhibition imbalance is associated with autism.
Wait,
So-
I'm going to go back and I'll edit this. What do you mean in this case about the cause and effect? What is the cause and effect that's being mixed up?
So, if children get diarrhea and they have headaches, do they get a headache because of the diarrhea?
The dehydration?
Or the dehydration? Or does the headache cause the diarrhea? These things we cannot easily separate. We don't know, and we cannot ask. These children are in the early second year of life. You cannot ask them anything.
I see.
They cannot tell you.
I see. So what are the next steps? What do we need to do to try out this hypothesis? And what do you need, doctor, as a research scientist? Tell me, this is something that we need to explore.
I need support from the community. The parents need to speak up and say, we want that. And we are willing to have children, for instance, participate in a clinical trial. Because one of the biggest obstacles is that people say, well, the parents will never agree to have their child treated, and they will never allow their child to participate in a clinical trial. I don't think that's true. If you, as a parent, have seen the child behaves abnormally, you have seen in EEG these epileptiform discharges. You have seen how your child differs in eye tracking. You know there's a high risk. And then the question is, would you give your child something like infant Motrin for 3 months to avoid your child from becoming nonverbal and have lifelong disability, need lifelong assisted living?
Wow, doctor. Also, add to those 3 or 4 situations you just described, symptoms. Add to that if it's a family who has autism in it. Didn't you once tell me that that's also another possibility that a sibling will get it?
Yes, siblings of children who have autism have also a higher risk of autism because they share the genetic risk, or many of the genetic risk factors.
So, doctor, how can I put your name and your contact number into the show, and if people want to contact you to be involved with the study, would that be okay? Is that what the next step we can do to help with this? How can we help you?
It's difficult.
It's not an easy process, I'm sure.
It's not an easy process because everybody is scared of doing studies in 1-year-old children. And everybody is reluctant, in particular because the parents are not speaking up. There is no... When parents are speaking up, they are a very powerful force and can make things happen. But if the parents don't speak up, it's highly unlikely that it works. Now, one problem that we have here is the intervention, and we mentioned that earlier, has to be in the second year of life. And most children who are nonverbal are older, and I cannot promise anything. I see that similar to amblyopia.
What is that?
My left eye was very far-sighted when I was born. Nobody has seen it, however, until I was 5 years old. Too late. Starting at the age of 2 years, we all lose the 50% of cortical neurons that are utilized the least. If we don't use an eye, the cortical neurons for processing information from the eye are gone.
Wow.
Forever. And there's very little you can do. And I hypothesize that with language it's the same thing. If children don't talk, during the second year of life, plus minus a couple of months, then the neurons are gone and they will never have a chance to speak again.
Well, short of a miracle, and we are people of faith, and we do believe in miracles, so I have to say that the Lord can.
Short
we
of
don't,
the miracle, yes.
Right, and we do believe that miracles can happen, but let's try to get the children to the point where they don't have to ask God for this miracle, because He's given us science to help people, and this is a wonderful idea that you've come up with to advance.
So we were talking about the motivation for the parents.
Yes.
Now, the parents who have children who are older have a lot of stress themselves. It's a full-time job to care for a child that is nonverbal. The child needs to be brought to different places, behavioral interventions, and they take time. They're not always in the place where you are. It's a lot of work. So they don't see. They're so busy dealing with their own child that the larger picture does not really come to their attention. I say, however, I think it should, because there's something that people don't really conceptualize yet.
And that is?
Every year, 20,000 children become nonverbal. They need lifelong assisted living and care.
How many people a year?
20,000 every year.
Wow. Wow.
Now, for each child, the cost over the lifetime is $10 million.
That's based on the estimated...
Just every year, you have to pay $100,000 for full-time care for the child.
Wow.
I'm rounding the numbers here.
Yes, but still, yeah.
And then the child will never have a job. There is another $10 million in lost productivity. $20 million for every child.
Wow.
50 children a day. That is $1 billion a day for society, or $356 billion a year. There is an avalanche coming that we don't see yet, but it is coming. And it will become more expensive than all cancers and cardiovascular diseases together. So I think that everybody who is active or involved in autism, being a parent, being a scientist, being a journalist, being whatever it is, needs to become aware that it's urgent that we do something to prevent children from becoming nonverbal. It is, you have parent organizations who organize and speak for the parents. Organizations should become involved and voice the concerns of the parents so that politicians and scientists know what are the issues that we need to address.
Okay, but I want something practical. I want some steps that people can take now for this show. I want you to tell the viewers, okay, voice your concerns. So they're going to call politicians and tell them that this is going to cost the society money, and to top it off, these poor people are without speech. I want you to give some practical direction to people with respect to you being a scientist. Are you going ahead with this research? What do you plan to do now with this? You have this hypothesis. You've been published in the journal. You're a well-respected scientist, and thank you for coming on. It's an honor to have you come on the show. I want you to speak to the viewers. How will you create this study besides getting people to participate? You might even need funds for research.
Well, here, what I'm struggling with is to bring to get a clinical trial done where we compare drug to placebo to see whether those who get the drug actually are better off than those who don't.
Okay, so now we're going to close with this. How do we make that happen? What's the next step?
You should talk, the parents need to talk to their parent organizations who will organize the effective way to make other institutions be aware of the parents' interest in having something done here.
Maybe they could write to you and you could give them a sample letter with the salient points, a bullet point flyer, for instance, even. These are the kinds of clinical studies we're trying to initiate, and this is why. Just a little synopsis on a flyer. I'm into a bulleted flyer so that they have something in front of them and they can take this to their organizations.
I think I'm not the most effective person to do that.
I'm going to
a
help you with that.
scientist.
Okay, I'm going to help you with that.
Okay.
Well, I'm going to help you market it because I'm thinking of the viewer and I'm thinking, well, this is all, I've got to write some letter. What do I say? What do I do? I'm going to help you put together just a flyer with some bullet points on it about your research, your hypotheses, a clinical study you want to do, and then we're going to, before the show airs, we're going to have something on it that will say, this is the person in politics that you need to write to, and this is what you want. We're going to take this the next step further. Thank you for coming on the show, Dr. Knut Witkowski. And I can't tell you how important this is to the viewers and how much I'm interested in this hypothesis you have, because it makes sense and because if it can help people who are suffering with this in their families, it's a good thing. Thank you.
Thank you.
Thank you so much. It's always a pleasure. Goodbye, viewers. Thanks for watching.